Hi, everybody. It's Tim Rowan, and welcome to this edition of Meet the CEO. I'm going a little bit less formal this time because I had the great opportunity to interview Barbara Karnes, who is a longtime hospice expert, former hospice nurse and administrator, and now a renowned author and the owner of her own publishing company, BK Books. I wanted to take this opportunity to chat with her, even though her time and mine were limited, and I wound up grabbing a few moments while I was in an airport changing planes. And so you'll hear a little bit of background noise, but it's worth it. This was the occasion of Barbara finishing her own experience from the other side of hospice. Her husband of 60 some years passed away last September of 23. And I wanted to get her perspective as a renowned hospice expert on what it meant and what it felt like and what she had learned and what the differences were between coming at hospice from an intellectual side as a teacher, helping people with her books, with their grieving process, helping families to know what to expect when a loved one enters hospice. So I thought this would be a perfect time to chat with her as she's been out of her, or she's been involved with her grieving process for about 6 months at the time of this interview. So I hope you enjoy it. There's a lot to learn from this wonderful lady, and excuse the airport noise, but I edited out as much as I could. So sit back, relax, and enjoy my conversation with Barbara Karnes. I First of all, my condolences, of course. When was it that your husband passed?
September 18th of
Oh,
last
okay.
year. So what,
Really?
5 months, I guess?
Well, you're in a unique position. I don't know if you know the book called My Stroke of Insight.
No.
It's written by a neurosurgeon who had a stroke and remembered and recorded minute by minute of every step of the process as no one else could.
Wow.
That's what I think of when I talk to a hospice expert like you about going through the process. And I'd love to hear what it was like for you because none of it was a mystery to you, but then you experienced it personally, and that has to be unique.
I think it probably was unique. I am a very mental person. I work more in my head than in my emotions. And putting on the shoes of a caregiver and living what I have taught mentally for years, um, put a whole different perspective on it because now I was feeling deep within me everything that was occurring. Where as a professional, I'm not feeling it, I'm observing. And then now I'm in it, I'm in the shoes and it's entirely different. What I learned in looking back is that I gave him more time than he really had. Um, I went through absolutely what everyone does in regards to food and pushing the food and arguing about food, and you've got to eat. And then one day it occurred to me that I'm trying to keep him alive and his body is trying to die. And with that realization, then I stopped pushing food and did what I recommend everyone else do. And that is always offer and never force. But I thought that was very insightful for me.
Comes under the category of physician heal thyself. You know what to do, but when you were in the middle of it, you were doing what you felt like doing anyway.
exactly. I wasn't even thinking about how much I know about dying. I was feeling um, how to get through this time and support and guide not just him, but the family. I mean, he was a healthy, um, he was at, well, let's see, he died in probably July. He died in September. In August, he was still driving his car. He was still going to get massages once a week. It was the day he couldn't get off the massage table,
Ah,
a couple of weeks before he died, that he came home. And I think that was when he let go. I think that's when he thought, yep, I don't want to live like this. And just,
so when did you enroll him in hospice?
it was about 2.5 to 3 weeks before he died. It
Okay.
was the time that I realized that I was trying to keep him alive and that his body was trying to die. And that's what, so let me see, that would have been um, September, what's Labor Day, Memorial Day, whichever one that I never remember which. Um, it was that weekend because I called on a Friday. And because it was Labor Day weekend, they didn't come out until Tuesday,
Mhm.
which in hindsight, and of course I always believe this, that hospices really don't have the luxury of saying this is a holiday weekend and we'll come on Tuesday.
Yeah, that I would guess not every hospice would make you go through that. There, some are better than others, as you know better than anybody.
Yes, absolutely. Um, but so from whenever the Tuesday was after Labor Day until the 18th, so what, that's 2.5 weeks.
Yeah, yeah, and that's quick. Although once you um, this is something that I'm guessing you dealt with both on the head level and the heart level. That once the hospice begins, you kind of take a breath and prepare yourself for the end.
Um, I believe that most people do. I think that, well, maybe I did too. Now that you say that, I'm not sure, because there was parts of me from the moment of diagnosis that I was preparing, thinking about him dying. And it was like a split personality, because there was a part of me intellectually that knew, that didn't want to see all that was unfolding. Um, so there's really confusion, and I I don't know if my knowledge helped or not. I don't know.
I, that,
Um, I looked for signs, um, but I was I didn't want to see them. And if you don't want to see something, then even if it's there, you probably don't see it.
so so I've asked you how your expertise in hospice might have changed your experience of it. But now I want to see if you've thought about how your experience of it might change future writings and videos.
Well, I I started out in hospice. Um,
in the early 80s, like literally 1980, when hospice was outside of the medical model. And I learned simply by being a hospice nurse, and my patients taught me um, what it was like to die. I I think that as hospice has evolved over the years, it has become more medicalized. It has been absorbed into the medical model, and hospice today is not what I started with hospice, what I loved about hospice, and what I see end of life doulas now doing what I did in the beginning of hospice. End of life
So,
doulas are filling
so
the void that hospice is leaving, becoming more medicalized.
they're back to the tradition that you began with. They're recreating that level of comfort rather than medicine.
Absolutely. So, um, my working with on a personal level with hospice, it just really and I have to say, the team that I worked with were dear and they were helpful and they did a good job. But compared to what I used to do and what in my mind and heart hospice is, um, that part wasn't there. And I don't think, I mean, I researched this hospice and it's just what hospice is different today. It's different. And that makes me sad. And I have written about, here's what I think is a good volunteer program. Here's what I think is a good bereavement program. Here's what I think nurses, here's, how many visits and how long do you stay? And, so I worked at getting my opinion of what end of life work is about. And we've kind of, we being hospice, I still consider myself part of hospice. Um, we've kind of lost the idea that our goal is the patient's death. Everything we do from admission leads up to the moment of death, the support, the guidance, the education, and all. That's the moment. That's our goal. And then everything we do after is in bereavement that slowly decreases our attention. But when I was doing it, my goal was to be with the family at the moment of death, to be with the patient to support and guide them. To me, that's meeting the goal so that we can have this family have a sacred experience, which will lead to a sacred memory that they will carry with them forever. Today, most families are alone when their loved one dies at home while they're on hospice.
And that to me just seems a mistake. It
Well,
goes,
it's difficult, isn't it, to pinpoint the moment and to be there?
well, yes, you can get as close really to hours before death. And that's how I see end of life doulas working with hospices. Let your doula get to know the family, and that doula's job is to spend the hours with the family that's leading up to death, and the hour or two following the death, getting the funeral home to come to support the family. Put that doula on salaried rather than hourly. And then you can blend the medical dying expertise that hospice brings with the time expertise, the time availability that end of life doulas have, that hospice is missing.
Is that how you experienced it in the early 80s? It was more like being there for hours and taking care of the family and letting them know what to expect?
That was the goal. That was the job. Um, you know, it was it was just part of my life. There were two nurses. We had probably 25 patients between the two of us. And one week, Jody would be on call 24/7 for 7 days. And then it would be my turn for 24/7 for 7 days. And the families, we guided them. When dad starts doing this and this and this, you call us and one of us will be there. And then we stayed. And, 2 or 3 in the morning, if you get a call and even if you know that you can answer the questions, if you don't roll out of bed and go make that home visit, then you're going to wake up at 7 in the morning and that family and patient's going to be in the ER. And most people expect to see grandma look like Judi Dench, say something very profound, and then close her eyes and mouth, and she's dead. So when that doesn't happen, when grandma doesn't do that, then the family thinks something pathological is happening. Something's wrong. And so education is so important, but having someone there who understands that dying isn't pretty. It's not like on television. And that's normal. Nothing pathological or abnormal is happening.
Right. You need somebody there to say, this is expected, this is what's going to happen. The question, how's the experience, you think, do you think, how your personal experience might impact the next book or two?
Well, it's already impacting the blogs that I write when I write about grief, because I intellectually do about grief, but wearing the shoes of grief has been really where my education about grief has been changed and upgraded. And I am writing blogs about that. I'm keeping a journal, and kind of in the back of my head, I might publish that journal after a year. I figure I'll stop doing the journal after a year. So I'm thinking about it.
That's what C.S. Lewis did with that book, A Grief Observed. And that was valuable to a lot of people because it was like a diary.
Right. And these blogs, what I'm trying to do is show people what's normal. And that, I just wrote one about negative thoughts, remembering the challenging times, and not really having anyone to talk to about the challenging times. And yet, when someone dies, they're immediately elevated to sainthood. So I'm giving everyone permission to know that this is normal. This is part of grief. You know, you're overwhelmed emotionally with the loss and what you've experienced up to that loss. I mean, that's exhausting. Taking care of someone before they die, that's exhausting. And then to be emotionally worn out, missing and sad, and then having to deal with business, with attorneys, with Medicare. You know, that's just such an added burden.
Yeah, but it's important for people who are going through it to understand that it's part of the process,
Exactly.
as much as you might hate it.
Yep.
Well, I'm going to do a formal thank you